back to the Stepped Up Nurse podcast. I believe that you're excited to be here just as I am excited to be here. Today we are going to be talking about something really amazing, and we are going to have a very amazing speaker on the call. She is Nurse Feyisola, and maybe I'll let her introduce herself. But today we are going to be talking about work in the pediatric. There's an aspects of pediatrics that is specific to babies that babies that they put in incubators. Because if I just mention NICU to you, you just be like, what is this not saying? Which one is NICU again? There's something called neonatal intensive care units, like intensive care units for adults, right? For children, we also have such a unit, and it's a very sensitive place, very critical place. But we have babies that come out of that place in perfect health, and they do well, they grow. In fact, I have a roommate that I usually call premature, right? She actually lived in the incubator for some years, and when we were in nursing school, I'll not let her hear what I'll say. You that you're a premature child, you are telling me that I was fully formed before I came out of my mother's uterus. You're telling me that you have sense more than me. Come on, go and sit down. She'll just be laughing. So today, welcome with me, Nurse Feyisola, to the call. Nurse Feyisola, over to you. Kindly introduce yourself. We're happy to have you today.
Thank you so much, Ms. Adesuwa, for having me. My name is Ayanrinola Feyisola, a registered nurse and as well as a registered pediatric nurse.
Welcome to the call. So today we would love to hear from you, your experience. How did you stumble into pediatric nursing? What happened? What's your journey like?
Okay. Thank you very much. First of all, let me start this way. For me, nursing is not just a profession, it is more like a call. Because I remember growing up, as a child, there was this time where I had different ideas of what I wanted to become. When we asked at primary school, when you grew up, what would you like to become? My first ever profession was to become a pilot. I remember telling my mom, I want to become a pilot. African mothers and the mentality, like a pilot, you want to fly feeling, God forbid. She was like, God forbid, it will not happen, this and that.
Why was she scared?
Good. Plane crash, that was our fear. That I won't lose I won't lose you to plane crash.
No, my children.
So I was like, okay, no problem. If you don't want that, I went to the game. I talked about it. I loved watching movies too. So I was like, okay, acting is not bad. I can act. I won't say God forbid. Those people, they are prostitutes. They can do this. They do different things to get roles and all of that. I was like, this woman, what do you want? So eventually I came up with becoming a doctor. So that I'll become a medical doctor. She was like, yes, that is better. That one is okay. This and that is a noble profession. So I lost the ambition of becoming a doctor for a very long time before I changed my mind to nursing. And what brought about the change of mind was passion for me. I found out that I just love to reach out to people when they are sick. And it's not just to reach out to them to just check up on them and leave. I like to do something to ensure that they get better. So I discovered that it is with nursing profession I can actually fully live that potential that I really wanted. It's not as if medicine would not do that, but while I got admission into the School of Nursing, then it began to make more sense to me. Like, yes, I'm not in the wrong place. I'm actually in the right profession. Because then I remember one of our tutors would always tell us, even our seniors then in school would always say, nursing is all encompassing. You are a teacher, you are a mother, you are like everything. You are even their prophet, you are a pastor. You
an angel.
Nothing is holistic. So I knew that yes, I'm in the right place where I really want to be. And being a nurse, you just discover that anywhere you find yourself, some people would even mistake you for a doctor. You have to tell them that no, I'm a nurse, because
I'm a nurse.
You answering questions on anything. Let them just come to you. Even finances, they will tell us then in school that when patients are on admission, for instance, you ask them about their family. How are they coping? The children at home, who is taking care of them? You just touch
Care of
every
them.
aspect of their life. So I knew that I was not in the wrong profession. Now for pediatrics, I have always known that I love children. I love children right from a tender age of, let me say, from my teenage age. But it was just more of church thing when you just gather children together, you teach them. In fact, up till now, my home church, they call me Iya Ewe, that kind of a thing. So I didn't know that it was going to become something big in the profession for me. I never knew that there was ever anything like specialization where you can specialize in taking care of just the children. So when I got to School of Nursing, we got more exposed. I'm like, okay, then my specialty would be pediatrics. And
Okay.
that was how it clicked. So when I got my first job and I was posted to everybody, when they recruit new nurses, they were posting everyone. For some people were even choosing, oh, I want emergency, oh, I want this part. But for me, I didn't say anything, I didn't give any option. I was just posted to the neonatal unit, and that was it. And the irony of the whole matter, while I
You
was
didn't
in
have any
basic school,
preference on your own. You didn't have any preference before they posted you, right?
I had in mind that, okay, if I'll be posted to a pediatric ward or unit, I don't mind. But I didn't say anything. Like, I didn't even open my mouth to choose like others were choosing. I was like, anywhere God wants me to be, that's where I'll be posted. So I was tested to
That's
the neonatal
amazing.
unit. And funny enough, the irony of this whole issue is, while I was in School of Nursing, I was never posted to a pediatrics ward for posting. It's either male
Really?
surgical ward, yes, either male surgical or male medical ward.
How did you escape it? Because I don't understand. How did they do your postings in your School of
Or
Nursing?
if you ask me till date, I don't know. Because I remember there was a time I intentionally, normally in School of Nursing, we don't have long breaks, just 2 weeks.
Yeah.
So I stayed back in school 1 week out of my 2 weeks just for me to have an experience in pediatrics ward. So
Yeah.
the only time I passed through pediatric units in school was when we were having the special units posting that was posted to NICU, and that was for few days. I don't think it was even up to a week. So, but I didn't allow that discourage me. I've always known it is pediatrics, and that is what I was going for. So when I was posted to NICU and I started to work fully, I was just excited about the job, though very stressful and draining. I would not deny that. Very stressful and draining. But because of the passion I have for these little ones, I enjoy it. I enjoy working. I enjoy being, even most times when I'm not on duty, I go to work. If I know that, okay, the senior colleague on duty is one I can learn from, I would, during my off days, I will go to work. And when I went for my pediatrics schooling for a year, it made it very, very easy for me because the experience was there already. It was just that we needed to have more knowledge so that we can become better and well refined in the specialty. So I finished pediatrics in 2022.
Okay.
And I've been
And
working
then you
in
so you
So I've been
intentionally
working
applied in a place that had a NICU, right?
No, I did not. I didn't apply there, but I was still posted.
Okay. Are you working under the government right now?
Yes, I work with Lagos State Health Service Commission.
Amazing. I've never heard a story like this before. Like, you were posted to where you wanted to be posted to. Because this one is like a miracle.
Not the hospital I wanted, but it has been the best choice from God. And in fact, I wanted to change to the hospital because I felt like the distance to my house. So I wanted to change to another hospital close by. But I was just encouraged that let me start, because I stay on the mainland and I work on the island. So I was encouraged to not change my mind. So since I started working in this institution, it has been amazing. Like, it has been amazing. And no regrets.
And there are other departments that they must have posted you to, right?
There are other departments. I didn't get that question.
There are other departments that they could possibly have posted you to, or because they were looking at your certification as a pediatric nurse, right?
I don't think so. With government recruitment, It is once the commission send you to the hospital. The hospital does not have anything to do with your CV, so they don't even know what you have done before.
They'll
When you
just post
go,
nurses
they will
anywhere
just
they
post
like.
you. Yes,
Exactly. That's what happened to me when I was in Lautech too. Because when I applied, thousands, I think hundreds, we were actually a lot that applied at the same time, and then they had so many nurses in their hands, and we were so many midwives. Midwives are the commonest. They are the manyest. So they post people anywhere. I wanted to work in the labor ward as per being a passionate midwife, but I was not posted there, right? So I had to make do with whatever I got. So I was actually posted to O&G. I worked in O&G for a while. That's gynae ward. Yes, I worked in gynae ward for a year, and then I was now posted to one other ward like that. I can't remember. It's quite a while now. It's up to 10 years now, because I worked there 6 years before I came to my present place of work. So then I was now posted to SCBU, that special care baby unit. In that hospital that I worked, we didn't have a NICU. We have SCBU there. I think in some hospitals they have either a SCBU or a NICU, or do they have both?
Yes.
Are there places that they have both SCBU? Okay, I think I've heard from my friend. I have an old friend
where I work.
We've been coming on together.
We have both.
You have both. Okay. Oh, that's amazing. Yes. So there are the people in SCBU are not as critical as those that are in NICU, right?
In the NICU, yes.
Okay, I worked in SCBU. In my SCBU, I think we had everything, both patients meant for NICU and everything. Incubators making noise. In fact, the noises are so many that when you are off, sometimes I'll be sleeping and I'll be as in the sound will wake me up. It's like post-traumatic stress disorder.
No, one thing is, I think some hospitals, they just choose to use the name sick baby unit. It's still the same thing as the NICU, although when they call a place a NICU, it's supposed to have some specialized equipment.
Yeah.
Which only very few hospitals have it in Nigeria. But I just feel some hospitals just choose to use any name they want. Some people will just call it neonatal unit generally. So it varies.
Yeah. So some people may call it neonatal unit,
might also mean sick baby unit in another hospital, and might also mean neonatal unit. It's still the same thing.
Yeah, but I think if an hospital has the appropriate management and they know the differences between these things, because you could have a pediatric ward and it will be a substitute for neonatal units. Do you understand? They will just call them neonatal units, and it will still be a pediatric one. You will see the adult children, adult children in quotes, and then you will see the smaller ones, and then you will see a small cubicle where they will now put one incubator, just manage. They will now force one incubator in one corner and use for those ones that are critical. So for where I worked, it was a full-blown unit. Yeah, that unit we have the inborn, outborn, inborn something, outborn something. We had inborn incubator, then inborn cot, outborn incubator. It was actually a lot of work. Like for me, I hated pediatric nursing so much. Like I don't even want to hear Kilode, me and children. I beg, excuse me. I don't want. I as in for me, it was a total no. So when they posted me, I was crying. I was like, why are you punishing me? Look at all these strange things. I don't understand. I will start measuring water drop by drop. What kind of rubbish is this one? For months, I was just complaining. But later I had to tell myself that, babe, you are here. There's nothing you can do about it. Just adjust. So when I started, I'm accepting the situation. I started adjusting myself to the mindset that okay, we are here, there's nothing we can do. I started the calculations, all the what's this titrating thing, this bottle, there's this bottle. There's for calculating the fluid, there's this bottle, there's something we call it. I've forgotten the name of that bottle and all of that. Please share with us, what has your experience? Solucet, you got it. I think when I started enjoying the process was when I had to start feeding babies that become better. we will measure 15 meals, 20 meals, and start feeding them five meals. I have to, night duties, I have to carry 2 babies at the same
Of
time and
course.
pacify them. Babies that are on new power round, I'll start
Exactly. Because they won't let you hear
sorry,
what.
don't cry, pele, you cannot eat now. Sometimes I'll be speaking, I'll be talking to them that, see, doctor is not ready to give you food, so me and you will be here till morning. Oh yeah, let's dance. We'll not be dancing around the world. They'll say, ah, no, so
That means
me,
you
you
did
know they
very well. You
sleep.
are good with babies.
No, I'm not good with babies, so not in that kind of manner. What me I think I like is, I don't like them crying. Right, I don't like seeing
Okay.
people in discomfort. That's actually why I like nursing, why I chose to stay in nursing. I don't like seeing people in
Mm-hmm.
discomfort. For instance, now, like my babies, when they used to urinate on the bed, if the bed wet, I feel so uncomfortable. Like, let me take you out of your misery. I'll immediately change the baby, take you out, change your clothes, and make sure you are dry. So the same mindset is what I juxtapose into nursing. If I see a bedridden patient or a patient that pulls on her body, I want to do everything. I don't mind the back pain, the headache, whatever, to make sure that that person is out of that suffering at that time. That's what makes
Yeah.
nursing it for me. So please share with us, what has your experience been, especially with mothers of babies that are in NICU? What has it been like?
That's another very strong point. Well, it has been, let me say, should I say like mixed feelings? This baby is just like adults. Yes, the
Mm,
sickness is different. The illness, the conditions is not the same. So we have babies that are very critical. We have those that are just here, maybe just to get medications, and after a few days they'll be out. While we have those that will
mm,
spend weeks or months, depending on the
mm,
condition.
mm,
So one
mm,
I've noticed so far is for those that come in to just get treated, maybe let me say for a week or for a few days, we don't really have much to deal with the parents. But for those that will spend
okay.
longer period,
A month,
after
two
a while,
months.
2 months, 3 weeks, even up to 6 weeks, after a while you discover that they become cranky and they are not just happy. Maybe today they will look cheerful and the following day they are just tired. Especially when the
Mm,
condition changes. For premature babies, at any point in time, their condition can just change. They can just come down with
mm,
something. Babies that you think are already feeling better, before you know it, something else crops up, and we have to start all over again. And we'll start doing various investigations just to find out what has happened or what the problem is. So dealing with
mm,
parents is also very challenging sometimes and can be emotional. The mother that you have
mm,
always seen each other and you're happy, and because baby's condition changes, they become
mm,
sad and they just want to withdraw to themselves, and we just have to keep
mm,
encouraging and reassuring them. Meanwhile,
mm.
we also have the ones that there is nothing you want to tell them. They believe they know all. They will even tell you, "This is not my first baby." You're
I
not the
too
one that will
know.
tell me.
ITK.
You're not the one that will tell me what to do to my baby or how to
Especially
nurse my
mothers that have
child.
3 children at home already and 4 at home, they'll tell you, kí
Exactly.
ni ṣebí bẹ́ẹ̀ la ṣe tọ́ àwọn ẹ̀gbọ́n rẹ̀, kí ló ṣe wọ́n.
That's just it. And sometimes even if you are trying to like make enquiry, take history of their previous births and delivery, they would feel like you don't need that information. Face the baby what they
Like you
have
are
brought to you.
prognosing.
It's like you are foreclosing, but we'll tell them that no, sometimes you just need to monitor the history. So we'll know that okay, this thing that is happening has not happened before, or there's something that you have been doing wrong and you are still doing is that is causing this to happen to your babies. But some will just tell you that no, they are not interested, and some that you feel like even when it's obvious that this baby's condition is so poor, they will tell you they are going on. There is no amount of what you want to say, no matter how much you try to persuade and encourage them, they just want to leave the hospital
To
premises.
go on.
So we have various, depends on individuals. We have different kind of individuals. Another thing with Niku is, is a very, it's not really a experiment, but we try as much as possible to prevent infection because these babies have not been immunized. That's when some parents will now tell you, my grandfather from the village has come, my auntie, my this, we tell them that it's not done here. We don't allow visitors. People don't come in here.
Yeah.
But they see it as though you are
And
policing them.
pastor and their imam.
Thank you. They will like, even men of God.
Naming ceremony.
That
Time
we
for
are
naming
here. We
ceremony,
are
they will
not.
say you should come and discharge.
In fact, it's a lot. And you know that these babies, they can't advocate for themselves. They can't speak for themselves. You know, to be an adult, you can say, no, I still have a headache. I'm not ready to go. No, I still have back
Yeah.
pain. I don't want to go. But these ones, they can't do anything for themselves. So when we try to like encourage them, they don't just want to listen. That is just it. They believe they can do anything. Especially when it comes to babies with jaundice. They'll tell you they still believe in all these using of pawpaw water and even breast milk. Like I've read a lot of
To
myths
clear jaundice. They'll
to
put
clear
the breast
jaundice.
milk in
Some
the
will even
eyes to
tell
clear
you
jaundice.
there's a nurse in their house that will give drugs. I'll be like, drugs for jaundice. How are people doing like this? So a lot of things, honestly, a lot of things to deal with.
So what has
The
been
only
your
thing is
saddest experience as a pediatric nurse? What has no, let me ask two in one question. What is
okay.
your most traumatizing, like your most uncomfortable procedure, like something that you don't like about pediatric nursing, like something you have to do every time but you don't like it? Then what was what have you had any traumatizing experience before that? Maybe like for instance, when I was there, I bond with some children so much, and then when you eventually lose them, and then I'll go home crying. I'll be like, God, why did you do this to me?
Yeah, of course. Okay. The first part, I really can't say, but the only procedure I do like at all in nursing is last office, both
Oh
whether for
wow.
adults or babies. I don't like last
Okay.
office, so that's like one
Well,
procedure I know I
everybody
don't
does
like.
not like last
But
office.
we have
Yeah.
no choice. I know after doing last office, you still have to encourage the parents. And another thing about nursing that is, I won't say I don't like it, because we still care about the parents and we want them to also want them to feel good before going home.
Yeah.
Is the fact that you have to hide your emotion. Even when you are not
Yeah.
happy, you are not supposed to cry in their presence. Even if you get home or you go behind a closed door to cry and all of that, you just have to act like that soldier woman or soldier man before you can now go behind to break down. That's one thing. And let me say a
Nurse
traumatizing
Feyisola,
experience that
thank you so much. Oh, I'm so grateful for this opportunity. I'm not happy
thanks
that we
so
have to
much for
go.
having me
I
as
know
well.
we can be here for the next 1 hour. Like I know that we still have a lot to talk about. Maybe we will do another part 2 of this session. But our time is up, unfortunately. Thank you so much for sharing with us this afternoon. If you are watching this video tonight or
I
today
can't hear
or
you again.
morning, please do well to subscribe to this YouTube channel and share this video with your friends so that they will be able to enjoy this series too. If you have a nursing friend that wants to go into pediatrics, also ask them to be a part of this video by watching and sharing with others. Thank you so much. God bless you. See you in the next video.